Treatment from the biological approach or the biological perspective for depressive disorders also includes antidepressant drugs. And there are a number of different categories of antidepressant drugs. Three broad categories are the MAO inhibitors, the tricyclics, and what are known as second generation antidepressants. So, to begin with, the MAO inhibitors. These are drugs, monoamine oxidase inhibitors, that were originally used to treat tuberculosis. But doctors noticed that the medication seemed to make those patients who were taking it happier. So they started investigating that a little bit. Now, these drugs work biochemically by slowing down the body's production of monoamine oxidase. And monoamine oxidase, or MAO, breaks down the neurotransmitter norepinephrine. So, MAO inhibitors stop this breakdown from occurring, and this leads to a rise in norepinephrine activity and a reduction in depressive symptoms. Approximately half of patients who take these drugs are helped by them, so they experience some relief from their symptoms of depression. But MAO inhibitors pose a potential danger. People who take MAOIs experience a dangerous rise in blood pressure if they eat foods containing tyramine, so things like cheese, bananas, wine, those sorts of things. So they have to be very careful about what they eat. Another category of antidepressant drugs are what are known as the tricyclics. And the tricyclics are believed to reduce depression by affecting neurotransmitter reuptake mechanisms. To prevent a neurotransmitter from remaining in the synapse for too long, there's this pump-like mechanism that recaptures the neurotransmitter and draws it back into the presynaptic neuron. The reuptake process appears to be too efficient in some people. It seems as if it's drawing in too much of that neurotransmitter from the synapse. So, this reduction in neurotransmitter activity in the synapse is thought to result in clinical depression. So, tricyclics block the reuptake process, thus increasing neurotransmitter activity there in the synapse. In searching for medications for schizophrenia, researchers discovered that imipramine relieved depressive symptoms, and imipramine and related drugs are the drugs that are known as tricyclics. And the reason they're called tricyclics is because they share a three-ring molecular structure. Now, in addition to the MAO inhibitors and the tricyclics, we also have what are called second generation antidepressants. And these antidepressants are structurally different from the MAO inhibitors and the tricyclics. Most of the drugs in this category are labeled selective serotonin reuptake inhibitors, or SSRIs. And these drugs increase serotonin activity specifically. So, with these drugs, no other neurotransmitters are affected, it's just the serotonin. And so, this class includes things like fluoxetine, which you may know under the brand name Prozac, sertraline, which is Zoloft, and another brand name, Lexapro. There are also selective norepinephrine reuptake inhibitors and serotonin norepinephrine reuptake inhibitors that are now available. And so these are referred to as mixed inhibitors. And the effectiveness and speed of action of all of these second generation antidepressants are on par with the tricyclics. However, their sales have skyrocketed. Part of the reason for that, clinicians often prefer these drugs because it's harder to overdose on them than on other kinds of antidepressants. And there are no dietary restrictions like we see with the MAO inhibitors. They also tend to have fewer side effects than tricyclics. So many times when antidepressant drugs are being used these days, clinicians may start out with second generation antidepressants and try to find something that will work for the person that has few side effects, because while the side effects of these are not the same as what we see with the MAO inhibitors and the tricyclics, second generation antidepressants do have some side effects of their own, including things like a reduction in sex drive. And so if clinicians can't find one of these second generation antidepressants that works, then they may try either tricyclics or the MAO inhibitors. Now, in addition to those different types of antidepressants, other biological treatments for depressive disorders include brain stimulation. In recent years, three additional biological approaches have been developed: what's called vagus nerve stimulation, transcranial magnetic stimulation, and deep brain stimulation. Depression researchers surmised that they might be able to stimulate the brain by electrically stimulating the vagus nerve through the use of a pulse generator that's implanted under the skin of the chest. And so research has found that this procedure brings significant relief to as many as 40% of those with treatment-resistant depression. Another technique designed to stimulate the brain without the undesired effects of electroconvulsive therapy is what's called transcranial magnetic stimulation. And transcranial magnetic stimulation has been found to reduce depression when administered daily for about 2 to 4 weeks. And I will link a short article on transcranial magnetic stimulation that you can take a look at. And then we also have what's called deep brain stimulation. This is a treatment procedure for depression in which a pacemaker powers electrodes that have been implanted in what's known as Brodmann's area 25 that we mentioned a little bit earlier, thus stimulating the brain. So this is based on a theory that there might be a depression switch located deep within the brain. So researchers have successfully experimented with electrode implantation in the brain's Brodmann area 25. Now, research on this type of treatment is still in its earliest stages, but for some people appears to be promising. And I will link to a short video about deep brain stimulation as well.